Good afternoon, everyone, and welcome. My name is Amanda, and I'm DWDC's Program Coordinator. Today, I'm joined by my colleagues, Kat Martins and Kelsey Goforth. First off, we'd like to begin by acknowledging that the land on which we gather here today is the traditional territory of the Wendat, the Anishinaabe, Haudenosaunee, Métis, and the Mississaugas of the Credit First Nation. These nations continue to experience ongoing colonization and displacement. Today, Toronto is covered under Treaty 13 and the Williams Treaties. Dying with Dignity Canada is also mindful of broken treaties that occurred across Turtle Island and recognize our responsibilities as treaty people to engage in a continuous process of truth and reconciliation with all peoples across this land. I'm thrilled to welcome you today. Through our webinars, we aim to provide you with information and key takeaways, as well as create a space for conversation on end-of-life topics alongside the professionals that know it best. This webinar is our final session as part of a special series for the month of May, where we focus on organizations working in the Maid space and the vital role they play in providing support to people across Canada as they navigate medical assistance in dying. Before I welcome today's speaker, I'd like to go over a few housekeeping items. Everyone on the call today is muted. However, there will be opportunities for you to submit your questions. To do so, please type your questions into the question bar on the Zoom side panel, and we will read it out for you at the end. In the interest of time, we ask that you please try to keep your questions as concise and clear as possible. And of course, while we are going to try to get to as many audience questions as possible, unfortunately, we may not get to everyone. If you have outstanding questions or questions that are quite personal in nature, we ask that you please email us at support@dyingwithdignity.ca, and we will follow up with you. This session will be recorded, so there's no need for you to take notes if you don't want to. There will also be a post-webinar survey that will pop up on your screen after the webinar and will give you the opportunity to share your feedback. We are also accepting registration for an upcoming series of our Death Dialogues program, so please enter your information in the post-webinar survey if you're interested in joining us. All right, and now to introduce today's speaker, we have the wonderful Tekla Hendrickson joining us. Tekla is the Executive Director for MAiDHouse with extensive experience locally and internationally in managing, operating, and advising not-for-profits in the areas of health promotion, homelessness, and women's rights. She has co-authored articles on developing processes to engage marginalized women in research, policy, and practice on the issue of homelessness and developing shared solutions. Tekla is a past board member of Women's College Hospital, unit director of Sistering, provincial director of Ontario Women's Health Network, and co-founder of Toronto Community-Based Research Network and Inclusion Research. She's also been a member of the Disability and Women Advisory Committee for the Association of Women Action and Research for Singapore, and was a delegate at the Governor General's Canadian Leadership Conference in 2008. So, Tekla, thank you so much for joining us today.
Thank you, Amanda, for having me. I'm excited to be joining everyone on the webinar and those who are watching it after. I look forward to sharing some information about MAiDHouse.
Wonderful. All right, everyone. For today's session, we'll be hosting a mixed format. Tekla has very kindly put together a presentation, so we'll start off with that, after which we'll conduct a short interview. So, Tekla, I'm going to go ahead now and pass the floor on to you.
Excellent. And I'm going to try and share my screen and make sure we don't have any technical difficulties. So here we go. Can people see my screen? I'm
Yep,
going
looks
to
great.
assume. Okay, perfect. So as Amanda said, we've been invited to do a webinar about MAiDHouse, and we really appreciate Dying with Dignity Canada in that they always use their platform and their networks to ensure that people are educated and have the opportunity to know about diverse resources. So we really appreciate them for that. So the purpose of the talk, or what I'm going to do, is just join Dying with Dignity Canada in discussing end-of-life issues and why the care and how this is so important to enhance end-of-life experience. So MAiDHouse is one of the organizations who's part of promoting this important discussion. I hope to give you an overview of MAiDHouse so you know who we are and what we do, and also in general to talk about the importance and impact of a safe space on your day of provision. So I'm hoping by the end of our conversation, as Amanda said, first I'll do a little presentation and then they have questions from the audience, that you'll have an understanding of MAiDHouse. You'll have the awareness of the issues that we experience around access, particularly as it relates to space. Talk about the impact of a safe and inclusive space, both from the physical space as a physical space, but also the psychosocial, the emotional perspective. And as Amanda mentioned, there will be time for questions. So I think one of the things that's important to me about MAiDHouse is just to understand us in the context of medical assistance in dying in Canada. So just not assuming, I'm sure a lot of you do, but what is MAiD? Medical assistance in dying in Canada is when a physician or nurse practitioner prescribes or administers medication that causes death. In June 2016, there was legislation passed. So I think that's really important, that it is a legal right in Canada. And this is how the context of how we deliver our experiences and services. And predominantly in Canada, it's through a series of intravenous medication, which is quite different than the US, where it's predominantly oral medications and self-administered. The other thing important to remember, we have the legislation of making MAiD legal, and then we have the advocacy and the community and Canadians' perspective of MAiD. And what we do know, thanks to Dying with Dignity Canada, is that 84% of people support this right. And this stays pretty consistent across age and different diversities. So MAiD itself is happening since 2016 to 2022. There's been 44,958 deaths that are associated with MAiD. The Canadian Health Report on Medical Assistance in Dying annual report provides all these stats that they are tracking. In 2022, it was about 4.1 deaths in Canada were related or associated to MAiD. Again, the importance of this is the context of how our services are operating in the bigger system. So where does MAiD most commonly take place? What we know from the various reports, the Coroner Report of Ontario, the Health Canada report, is that it can be at home, the hospice, long-term care facility, or other places that are meaning to the person. That could be outside or a cottage, at a friend's house. Predominantly in 2022, the most people, 39.5%, were in private residence, and 30.5% were in hospitals, and palliative care accounted for 20.8%. So the majority still are in some sort of institution, which I think is interesting to note. So what does that mean for MAiDHouse? Why do we need a MAiDHouse? Mark Somerville was one of the early people who talked to the co-founders of MAiDHouse, and these are the stories they were hearing and why they were working so hard to open our door. So as you see, Mark says, when Mom started thinking about undergoing the MAiD procedure, one of the challenges for her was where she would be most comfortable. She couldn't stand the house where she was living. It was dilapidated, moldy, and would not be comfortable for this extremely powerful moment. Also, she had always disliked hospitals and their sterile and clinical surroundings. MAiDHouse would have fit her needs perfectly, somewhere supportive that felt like home, a comfortable and safe feeling space to take her last breaths in the life. So as many of you would know, applying and navigating the request and the eligibility and the requirements for medical assistance in dying is not necessarily an easy process. You are also contemplating your moment of death. And on top of that, people are worried about where they might do that provision. The other thing that the providers, people who have supported people having MAiD, bioethicists, realized that there was unequal access to space. That could be, people were worried about loved ones' association of their home with death and loss. It could be faith-based institutions not allowing MAiD on their premises. There's also landlords who don't allow MAiD on their premises. Individuals finding their housing not appropriate, whether it was crowded, not accessible for their guests, or other reasons. Some people found that they had family members that were not supportive of MAiD, and one of the ways they showed that they weren't supporting that is by not offering up their space. And then there is just overall discomfort of death and loss. One of our co-founders, Dr. Sandy Buckman, who is very active in palliative care and is a MAiD provider, kind of notes that, the vision is for anyone who requests and is eligible to receive MAiD and whose own home environment is not suitable or an option in which to receive MAiD, they don't have the same equitable choices. So he goes through about, again, these different institutions for a variety of reasons who don't allow it, and that therefore that doesn't provide an optimal environment. So he really identified and joined with a group of co-founders to then establish MAiDHouse. So who is MAiDHouse? MAiDHouse, our goal is to create the safe and supportive environment. When we started about the space, they were really thinking about the physical aspect of the space, that it would be a welcoming and inclusive space. And at that time, we weren't aware about all the other services that would be required. And so I'll talk a little bit about that. But the original vision was about the physical space. Now, in terms of the goal and mission, it is about acknowledging and supporting both the space in its physicality, but also in its psychosocial experience. We were incorporated in 2018, but didn't open our doors till in 2021. It took a long time for us to find a space. Once they started, the beginning of the organization was just getting the right people at the right place, having the board, getting our charitable status. But then when they opened the doors, or we looked to open the doors, we found that the stigma around death and dying really impacted our ability to find space. Thankfully, we had a small nonprofit who provided us a programming room so we could open our doors. And then from there, we've been able to find another space where we are able to offer our services. Our three key programming areas are what we call our access to space. Obviously, when you're dealing with death and dying, particularly the day of dying, you need to have experience and supports around grief and bereavement. And like many of the people who are supporting medical assistance in dying, we support and work on education, research, and training. I think it's important to note that, as it says, we are one of the first in North America, and certainly the only one who is offering these services free of charge. If you want, after the session, I encourage you to go on our website and look at our MAiD journeys. In there, you will find a variety of people who have used MAiDHouse and have shared why they have used the space. What we have found, though, that people equally want to talk about why they're choosing MAiD or about their life. It is at the end of their life, and they take these moments to reflect on what that matters to them and why it's important. So I strongly encourage you to look at the MAiD journeys and hear people who have accessed our services prior to using our services, why MAiDHouse matters, and those that supported them have also shared some of their experiences. So our biggest program and our most critical program is what we talk about is the access to space. As I've mentioned before, it is a program that takes into account the physical and psychosocial needs on the day of provision. So people come, they book our space just on the day of, and we work with them and those who are supporting them to personalize and enhance their experience, both in the physical of the space and other ways that they might want to have their last moments at their provision. We also look at supporting, because often people come with those they have chosen to be there for that moment. And once they have died, they are also looking for support both before and after. I know that there's been other webinars from MAiD Family Support Society as well as Bridge C14. I encourage you to look at those webinars in terms of learning them about their service. They also provide exceptional support for people who are supporting people who are having MAiD. The other thing that we have found is when people are thinking about grief, they also often think about support groups or therapy or one-on-one counseling. What we have learned through our work and our research is that having clear logistics, supporting people with the funeral transfers, people having a clear idea what's going to happen at the day of provision does have an impact, a positive impact on grief and bereavement. Knowing what to expect in the moments of death, having an awareness of how fast things goes all helps people manage and process that experience. Along with grief and bereavement, as I said, our access to space actually incorporates a lot of our grief and bereavement. We have been lucky to be funded by CAMAP to do work around grief and bereavement. From that work and doing the environmental scan, we've learned what supports we can embed in our access to space program to further support people's grief and bereavement experience. As I say to people on the day of death, that no matter how well we do or the supports we offer, I cannot take away people's grief and sadness. That will be part of the experience. But what we can do is surround people and provide them the necessary resources and supports while they go through that experience. We do have a fact sheet on seniors, Maid, and grief and bereavement. And at MAiDHouse, we give away a cartography of grief, which has the map of grief done by Megan Devine, and on the back is some resources that are national scope around grief and bereavement. Another one I haven't mentioned is the mygrief.ca done by Canadian Virtual Hospice, and they have specific resources around Maid, as does Wellspring, who does programming specific to Maid, cancer, and grief. We are doing a National Memory Quilt project. So if you yourself have supported someone through Maid and you want to remember them, we are inviting people to make a quilt square. For more information, you can go on our website and look up the MAiDHouse Memory Quilt Project. We've already got a few quilt squares sent to us, and they are beautiful. And I imagine the quilt we will put together across Canada will be amazing. As part of our work around grief and bereavement, we developed this conceptual framework to understand our work and what that means. So we look that there's a root of, supports and experiences, emotion happening as people are going through this provision and accessing medical assistance in dying. We know that the concept of the good death, what happens after the death, the process to get there, the relationships that are surrounding you, and the planning all have a way of impacting your experience and your grief and bereavement around medical assistance and dying. So we use this conceptual framework, as I said earlier, to kind of plan and program our access to space program. If you would notice, when we went to a group of advisors, we had a totally different image. And one of the things that really came out loud and clear is that this experience is not linear. So our conceptual framework is trying to present a more dynamic experience, as does our programming, where we're really person-centered and responsive to people's needs and what they are thinking their day of death will look like. Our education programs are as what you see. We have a bi-monthly newsletter. So when you're on the website, maybe signing up for the National Memory Quilt Project or looking at our Maid journeys, I encourage you to subscribe to our newsletter. We do have a virtual event on June 4th where we'll be doing a book club of The Many Faces of Maid. We encourage people to buy a copy on Amazon and then join us with the co-creator, a researcher, and a Maid provider to kind of explore what are the stories in The Many Faces of Maid. I've mentioned throughout our presentation just some other organizations that I think are important for people to know about. Bridge C14, CAMAP, Canadian Virtual Hospice, both their general Maid information and their My Grief, Dying with Dignity Canada, which of course you're all familiar with, and Maid Family Support Society. And to learn more about MAiDHouse, again, you're encouraged to go on our website, subscribe to our newsletter, and to continue the conversations. One of the features in our newsletter is our Philosopher Corner, and people find that very thought-provoking. So again, another reason to join us and subscribe to our newsletter. So I'm going to take the moment to stop sharing my screen. And I believe Kelsey is joining me to ask some questions or help facilitate that part of the discussion.
Yes, thank you so much, Tekla, for taking us through a bit about what MAiDHouse does, about what the experience is. And I think this has been a great introduction to the organization that's doing such incredible work in the community. So we will get started with some questions that we already had prepared. To those of you joining us today, we do see your questions coming through, and we just want to encourage you to keep them coming. We're going to try to get to as many as we can in the time we have together today. So, Tekla, the first question we had was about the services and resources that MAiDHouse provides. I know you went over a lot of those already. Is there anything that we missed? Anything that you wanted to highlight that we didn't quite get to during your presentation?
I guess one of the things around our Access to Space program, which is important to kind of acknowledge, is MAiDHouse is really focused on the day of provision. So we are not helping people navigate their requests or their eligibility or their assessments. So your organization does that work, as does Maid Family Support and Bridge C14. So we are really focused on the day of provision, and then we work with the person having Maid in terms of what that experience is going to be like. And then often that entails working with those who they are inviting with as well. So I think that's important in terms of just a focus of our work.
Yeah, absolutely. And I think that leads nicely to some follow-up questions about exactly that, which is for those individuals who are coming into MAiDHouse, how long are they typically within the space? What does that timeline usually look like for them?
Yeah, so those are some of the learnings that we had. So in general, we try and do only one provision a day, though sometimes we have two, and they're quite spaced apart in hours, because one of the things we don't want is for people to feel rushed. And then again, how much time is really personal. So some people just want to come and it's just a medical procedure and it's a day and they want the shortest time as possible. Other people want to invite people, share music, share food. So at minimum, we ask people to come at least 30 minutes to an hour before the provision starts. And that's actually not for the benefit of the person having Maid, but those who are supporting them. Because if it's less time than that, then the people who are supporting them do find it is very fast and, a little bit takes their breath away of that experience. So people come at least 30 to 45 minutes. They have time to get settled in the space. And then people can actually, we've had people be 4 or 5 hours before, and then people can stay as long as they want after if they have different ways of commemorating or acknowledging the moment that the person has died. So it really is attuned and personal to what people like. We help people and support them with consent to organize their funeral transfers and help with that, so people after the death do not have to just immediately phone or deal with those logistics of death. One of the things MAiDHouse is learning to balance is that there is actually a lot of things that people who are applying for medical assistant and dying have to navigate, logistics they have to get in place, but yet we know it's a very profound experience. So how you support people with the logistics, but give the space for the emotion and the profoundness of the experience that is happening.
Absolutely. Thank you so much for sharing that and giving some additional context, especially for people on the call who maybe haven't had a personal experience with MAID. So the next question is about how individuals find MAiDHouse and sort of what that looks like. So do you have requirements that make a person qualify to access MAiDHouse's services? Do they need a referral from their MAID assessor, from a physician, a nurse practitioner? How does that look?
So I think that's really important to note, if you'll see in our mission and vision. So MAiDHouse's, objective or vision is not to increase the number of people who have Maid. That's not something that we are looking at. As I mentioned earlier, it's about the conversations, and what we do want, along with Dying with Dignity Canada and others, is that people are talking about their advanced care planning. They're looking at their end of life wishes. They know that Maid is an option, and when that comes to them, they know how to navigate that. If that's what they want, or if they want a hospice or palliative care or other options, then they know how to access those. In terms of accessing MAiDHouse, people actually do that through their Maid providers. So the Maid providers request to be on our list, and they put in a request. We take a look at that, and they sign in that they will work with MAiDHouse, and then they can book our space for MAid provisions or for assessments. So through their MAid providers, they are then able to kind of access the space. And if you can get to MAiDHouse and you've been approved for MAid, then anyone can use the space. The only requirement we have is that people sign a consent form. They need to let us know who their next of kin or executor is and who their funeral home is, because we do have to transfer on the day of. So those are the baseline requirements.
So are you usually having people approach when they've gone through the entire MAID process? They've been approved and all of the paperwork, everything's kind of done, or do people contact you earlier on just to understand what their options look like? Is there any themes you
So a bit of
see?
both. Mostly people have a MAid provider and have gone through assessments, but some people who are planning and starting their requests might ask us some questions, or and we have a brochure about what is MAiDHouse, so that gives them some things to think about as they're thinking of the space and place that they might want to use. I think the other thing that people like about the places that of MAiDHouse is we talked about it is actually sometimes a caring of the person who's having MAid, in that they're worried about those who are supporting them, and they find coming to a space that's not their own is helpful, and also having someone from MAiDHouse there who they know is going to follow up with those who supported them and is there on the day of to help them navigate the different things that are happening on the day of provision. But
Absolutely.
doing that without it being institutional or a more clinical setting, so people appreciate that.
Yeah, for sure. And you touched on just now, you're touching on some of this and during your presentation as well. But are there other ways or examples you can think of where either a medical facility, a hospital, or even at home where it's been a situation of a sort of a lack of support, and any other reasons or examples of what people have experienced that bring them to MAiDHouse?
I think there's definitely sometimes judgment or people who don't want to be involved, so they're looking for that extra support. Again, just that plain discomfort. It's not that I have many people who, don't necessarily support or not support the medical assistant in dying. What they're focused on is supporting their person and their wishes, and that is their focus, and then not comfortable with death and dying. So it's helpful to be able to come to MAiDHouse again, as I said, for that support. There's some kind of simple reasons where people's places don't accommodate all the people they would like there, or is not accessible, and ours is accessible for we have accessible to our space. The other thing we have seen, as we've talked about, is institutions who just don't allow it in the space. So we call those forced transfers. Those are not our favorite. That is often a painful experience for people to get to us. Once they're there, we're able to provide those supports and resources as we do for others, but it is a bit of a rough journey to get to us.
Yeah, absolutely. So we'll switch gears a little bit now to talk a bit about some of your observations and what you've experienced when there for individuals who are going through MAID and their families. And the first question is just about challenges. Do you notice any themes with challenges that loved ones have when they're supporting their person through the MAID journey?
I don't know. It's just I'm not sure they're challenges, but experiences, and I think this is quite common for any kind of caregiving. Is that people being so focused on the caregiving and rushing so fast to make sure they meet people's needs and enhance their end of life experience and meet their wishes, and then when it's over, it's just like like what just happened. So they don't necessarily have the time or place to process that. I think one of the interesting things is medical assistant in dying is very much focused on the person who is eligible and approved for MAID, as it should be. So they're the only ones who can request it. They are the only ones who can consent to it. But we know that it impacts others. So how you do the work so that you can provide support and focus on the person who having MAID, but also account for the different needs and emotions that might be going on for other people who are supporting them. I think the other thing, I mean, that we see is we are very privileged to be there on the day of death, but people have different dynamics. And, you know, my glimpse into that dynamic, I'm not necessarily going to be able to support or help work out what people have been doing as family systems for, you know, 20, 25 years. So people are processing those kind of things. And I think then just finally, just kind of balancing wanting to be there to support, to personalize, but also people not feeling pressured that it has to be a certain way, like I have to have a party or I need all this music. Maybe I just want a small group or maybe I want it quiet. So really messaging and letting people know it's really unique and to that individual how and what they want it, and there's no right way to do it and there's no must way to do it. It's what you are looking for and would be open to you. Some of the things that are sometimes that cause me sadness or that I worry about is that sometimes we have people of not all, some are supported, but there are some people of faith who I think they would like their people who represent their faith to be there at that moment and stuff, and that's not possible. And so that can cause some sadness for people. And again, you know, that's not across the board. We also have had people of faith who've come and done blessings in the space and things like that.
Great. Thank you for sharing that. I think the observation about what happens at the end, whether there's a lot of people or few, and all these decisions, that theme of choice really um, being a common thread, which really is all throughout Maid and in so many ways. So it should extend to those final moments when it comes to the gatherings and such that people choose to do or not do. So
Yeah, and I think another thing someone just highlighted while we're looking at establishing a MAiDHouse Victoria, and one of the key people there mentioned it, and then I experienced it with someone supporting the provision, is just also the concept of time, like slowing things down, making people sure know what's going to happen and not rushing through, like giving those moments for those moments are really important, and which we actively work to provide that space for, and people really appreciate that.
yeah, for sure. I think that before we move forward with the other questions we did have an audience question. I just think it's a nice time to ask based on what you just said about Victoria. So this person is wondering if there's only one MAiDHouse. They're not sure what city it's located in, and if there's plans to expand. So any other comments on that?
Yeah, that's probably key information I should have given in my presentation. So at this time, MAiDHouse is based in Toronto and serving the surrounding areas. We are a national organization, so we are hoping to meet the needs that are identified for people for MAiDHouses across Canada. And as I just mentioned, we are in talks with Victoria to establish a MAiDHouse there.
Great. And for people maybe outside of the GTA, someone else is wondering if there's the option to come into the GTA to MAiDHouse to be able to use the services at this point.
So as long as you have a provider who's on our roster so that they can legally provide Maid and they can do it on the Toronto site, then that is not a problem for us. And then as we talked about, people have to sign a consent form, have a next of kin, a funeral home. We have had people transferred to funeral homes outside of the GA to across the states and into Quebec as well. So I know those are possibilities. Obviously, there is a connection with a Toronto funeral home, but there is processes is available.
Okay, great. Thank you. Um, so you also spoke about earlier the discomfort with just death and loss in general, and that being a bit of a complicated relationship that many of us have about this thing that will all happen to us, but we really struggle with it sometimes. Um, how does MAiDHouse support someone who is experiencing that discomfort with death in general? Is there any specific programming or approaches that you take to that?
So we do support through conversation and talking to people. We also refer people to Maid Family Support Society and Bridge C14 because particularly for those who are supporting them, there is sometimes those moments of, wow, I'm helping someone as they move towards their day of death. And that, that is a process we have to take. We have a pilot project with a psychiatry program where if you have cancer and have been approved for MAiD, that you can access some sessions. So we're starting those resources as well. And then the Canadian Virtual Hospice, the Many Faces of MAiD are resources that we point people just for those shared experiences. But sometimes it's just being there to listen and acknowledge, that this is going on for someone.
Absolutely. Thank you. And for those, again, just speaking to death being complicated for many, is there anything that you would say to somebody who's hesitant to seek support? Any advice you'd give or insight?
For those who are supporting people, or for those who are having MAiD, or
Yeah, I think for both.
Uh, I don't know if there's fight. I mean, I think it goes back to the beginning of what the purpose is, the importance of having end of life conversations and working through those through other people. The other thing that we've had and that we also focus on is the importance of art. We have a lot of, paintings and art in our space, music in our space. We've had requests for, lists of poems and poetry that contemplate and reflect on death, because people want to sit with that. So we have curated a list, and we'll continue to build that list, so we give people ideas like that. I know that there is a directory of end of life doulas, and they have a lot of skills and expertise in helping people support people process that. I do think reaching out to others can be helpful, as long as it's a safe place and space. And again, the contemplation of reading books, poetry, art is another way of kind of reflecting on those moments.
Thank you. Um, and in your space, you're meeting people at various stages of the journey, people who might be accessing MAiD themselves or their people who are surrounding them. In your time with the organization, have you heard misconceptions about MAiD in Canada? And if so, do you notice any misconceptions that come up more often than others?
I guess, like, in the work itself, I don't necessarily. I mean, there are times that people, because sometimes people don't have time for a tour, or don't do our virtual tour, and so they're surprised that it's not a clinical environment, like how lovely the space, how peaceful the space is. We hear things about that. It's more in terms of the conversation, the public conversation, that it's so easy to access MAiD, or not, or anyone can get MAiD, and you see people and the work they do to get that, and the judgment around MAiD. And I see people coming with the supporters, and I'm like, people have worked in process, and not always, but often their most intimate loved one is there on that journey, and releasing them and respecting them. And like, you don't just do that, right? Like, that no one does that easily. So they obviously understand people's requests and wish, and give this gift of support in a moment that is entirely painful for the grief and loss of their loved one, right? So I think people, if they kind of bear witness of to these intimate moments of where you can see the greatest gift of just supporting a person as they've been approved, and move forward.
Thank you, Tekla. And I think that leads nicely into our next set of question, which is about grief itself. And this one's about you and your colleagues working at MAiDHouse, and you having um, the chance to be with people during these very profound moments. And we just are curious how that is for you, and if you experience grief, and any lessons you've learned over your time with MAiDHouse to help you through that experience.
Yeah, I think around death and dying, that you all obviously experience grief, but one of the things, it's not my story and it's not my experience. Like, I am there and supporting it, but I am not the central person of what is happening. And I think really acknowledging that. I think it is like the people who are supporting as the person who's eligible comes to MAiDHouse, respecting that wish and seeing the work and courage and, just that belief that death is part of living and, and how people take that on, I think is really, really important, connecting with nature and your community and just celebrating life in all its fullness. I think helps with those kind of grief and bereavement. And sometimes it's just sad. It is sad. And so you're sad. And that's okay. And you sit with that and you take a moment to remember that person. And it matters. It matters to a lot of different people. And I know when I'm doing the follow-up call with the primary support person, one of the things I'm struck by the many stories I hear is we often think of the big moments like we've missed an anniversary or it's a holiday or a birthday. But what people are really missing is some of those very mundane just moments of day-to-day life. Like I came and I was so excited and I was going to share and the person's not there to share. Or I did this chore and they usually say, good job, and pat me on the head, and they're not there. And it just takes their breath away. So it's, those just very small moments that just bring you to your knees in terms of the feeling of loss and grief about that. And then conversely, I hear people take comfort that they chose and they had some control and it was experienced as a peaceful death, and people make meaning from that as well.
Yeah, and with the meaning making and sort of channeling everything that the person goes through and experiences with their grief, you had mentioned the MAiDHouse memory quilt, which sounds just like a lovely project. So we're wondering if there's any other options you've heard of, any other alternative forms of processing grief. You mentioned earlier art and poetry and things like that as well. Is there anything else that you've heard of that people might use or look into?
I mean, I think there is the official kind of like some hospices offer support groups and have a lot of experience with grief and bereavement and are open to supporting people with Maid. Wellspring has grief and bereavement. Funeral homes often have expertise on grief and bereavement. I also think it's just the understanding that many people have had relationships for 20 and 30 and 10 years, that you're not just going to get over it. Like it's going to take moment in time. And, we're a pretty fast get over it kind of society, but yeah, no, it's going to take time and it will be with you as you move and flow through life. People exercise, but I think mostly it's wrapping themselves in community and giving that kind of space and time.
Great, thank you. So before we wrap up this section and head to our audience questions, we just had a couple more about involvement of others who might want to get involved with MAiDHouse. So the first is related to any volunteer opportunities for non-healthcare providers. And if somebody is interested, how would they go about that and what's required? And then the second part of that is if there are doctors or nurse practitioners who are Maid assessors joining us or watching the recording later, is there space for additional clinicians to join the team?
Yeah, so I think one thing that's important to note that MAiDHouse is not a medical or a healthcare facility. We're a community-based social service kind of support. So we are part of community-based and part of community, and we frame ourselves around those community resources and support. So we are not a medical model of care, so to speak. In terms of volunteering, as every small nonprofit, whether it's Bridge C14 or Maid Family Support or Dying with Dignity Canada, we have need and expertise for volunteers on fundraising. On our fundraising committee, we have a very robust communication committee. We do have a program committee where people who are social workers or lived experiences join us. We have opened a training program for our access to space where people can be there on the day of provision. It's quite a robust screening process to access or to become a part of that program. Those applications are on our website. And we do research or looking for partnerships around research or programming. And if people have died, so the National Maid Quilt Project was actually someone came to us Christy Sirota and offered to do that and gave us a framework of how we could do this program for us and volunteered to help us bring that forward. So that's a volunteer run program. In terms of MAiD providers and assessors, again, getting on our MAiDHouse roster, we also have a clinical practice committee that helps guide our programming within the services. And we'll be opening those committees in Victoria as well as we start moving forward with the work.
Excellent. So in addition to the Victoria MAiDHouse and the Quilt Project and other things that you've mentioned today, is there anything else upcoming that you're working on that you wanted to highlight for us today?
I think what I mentioned was the virtual event with the Many Faces of Maid. It will be in a book club format, so I hope you will enjoy us for those conversations and the content. And you can subscribe on our website. And we are doing research, which we hope to publish in a journal where we talk to over 10 interviews with people who supported people who accessed Maid at MAiDHouse to kind of see if our concept of our conceptual framework and what we were doing is actually positively or supporting the grief and bereavement journey. So we're learning from that, and we'll soon be publishing an article, we hope, with that research.
Excellent. Well, we look forward to seeing that research. That sounds really interesting and helpful to understand patient and family support in a whole new way. So we are going to open it up now to some of the questions that have been coming through from the audience. So I know you covered this earlier, but this person is wondering if there are any associated costs with this service or if it's covered by OHIP. And for our people outside of Ontario, OHIP is just our provincial health coverage.
So medical assistant in dying in Canada, so your health provider in that is covered by our healthcare system. MAiDHouse is not associated with our healthcare system. MAiDHouse itself, to access our space and our support services, is supported by our individual donors and foundations. So there is no cost because of the generous donations of these individual donors and foundations. The only other cost that I know people have had associated is when they've had to do a forced transfer and they have to pay for their own ambulance transfer to move from their facility to MAiDHouse, and that's through a separate company.
Okay, great, thank you. So somebody's asking, we covered sort of the volunteer side of things, but somebody else is asking how we can support MAiDHouse further. And also asked in the same question if you envision forced transfers lessening anytime soon.
I don't anticipate forced transfers being lessening, at least in the Toronto site, given what's going on, but it might happen in like in Quebec, there would be less forced transfers or no, because all facilities are required to provide MAiD. So it's going to be a province by province experience, I think. And Dying with Dignity Canada, I think, will have a lot more information about the national conversation around forced transfers. In terms of, there was another question. Sorry, I missed.
That's okay. So aside from the volunteering that we talked about before, are there other ways that folks on the call today can support MAiDHouse?
I think subscribing to our newsletter, participating in a virtual event, coming up with the ideas that you might be able to help us programmatically or move us forward, volunteering on those various committees I talked about, and obviously donations are always greatly appreciated. But those are some of the ways, promoting the MAiD, amplifying. And then just, I think it supports all of us when people have end of life conversations that are open with a variety of opinions, and just carrying on those conversations in our community so that when someone brings up MAiD, they're able to talk about it and get the support, and then think about places like where they want to have MAiD, what space that might be.
Absolutely. Thanks, Tekla. And people asked a bit about sort of helping with the forced transfer issue as well. And Tekla, you touched on Dying with Dignity Canada's role in that. So we do have some information on our website about forced transfers and institutional religious obstructions. And if anybody experiences that, we do want to hear about those stories. So do reach out to us and let us know. It is an ongoing issue. And like Tekla said, it's something that is happening in provinces in most parts of Canada. So certainly ongoing in that way. Um, so you touched, Tekla, on this before about the moments before somebody has made and the decisions that they make about what they want that to look like. You mentioned poems and music and different foods and things like that. Do you have any other observations about that or interesting approaches that people have taken to those final moments with their loved ones?
I think again, MAiDHouse supports the personalization. So being able to have the moments for those conversations or times where they can think about what they want. I think again, I talked about not having pressures to do certain things. And I guess my other learning is every time I think I might have a sense of what will happen, everyone has been unique and very different, even though, there's not like, is there anything, I've had someone crafting there how people get to MAiDHouse. We've had people come in limos, but so there's all different things that people do, but it's kind of reflective of how they lived and what they were doing as part of their living, and they carry that on with their planning for their day of death.
Absolutely. Thank you. So you mentioned before this isn't a clinical space. It's supposed to be very warm and home-like. And somebody is wondering if you can describe it a little bit more, like what the space is like inside and what people would expect if they were walking in.
Yeah, I think that's really interesting because sometimes, people who are coming to use the space have tours and it takes all of about 3 minutes to do the tour. And I say to them, it's as simple and as profound as that. So it's an apartment kind of setting. The first room is where the maid providers, and the IV nurses set up and prepare their preparations, and I'm there. I'm as present and not present as people need be in the space. There's a washroom, there's a full kitchen. So people say it really looks like, someone could just live here. Then the front room has a fireplace, as it has a couch. Some people use that couch. We have a big dining table kind of pushed to the side, chairs. The furniture, except the big table, is all movable, so people rearrange the room as they come. Then we have another room just beside it, which can close doors because sometimes people separate who can be there in the moment of provision and who will wait outside, or they take moments to share special words with people one at a time, and they have a way of separating the rooms or joining them together. In that other room, there's a medical recliner, which is really a lazy boy, that can open up full. We have another couch that can be a pull-out bed. No one's used it as a pull-out bed. Other chairs, lamps, art, and that's really the space. One of the other things of the people who helped, decorate it and think it through, that's not my forte. I could not design myself out of a shoebox, but is just that idea that the space is not overwhelming, that it's welcoming, but it doesn't have a huge personality. Because what's interesting is people come in and bring themselves and who they bought, and then sometimes bring flowers or pictures or other things. It really takes on that energy and space of the people who are there at that moment.
Great. Thank you for sharing that. And is there any outdoor space at MAiDHouse?
So we don't have easy access to outdoor space. We've had one request that didn't go, but we could kind of create a little connection. Ideally, when we move or, start having more space and access to space, we will build in some outdoor space, but we don't have that so readily available.
Thank you. Somebody commented, I think a few people actually commented about the flower image of grief that you shared earlier in your slides. Is that a graphic that's available online, or do you know where
So
people
it's
could?
in a research paper. So the graphic is in that article that we published about the environmental scan about literature and grief, and then we present the conceptual framework in that paper, and that's open source journal, so it is readily available to people.
Okay, awesome. Thank you.
Do you want me to put? I don't
Yeah,
know.
if you wanna send it over, we can put it in the email that goes out to everybody after. If you wanna just email it to me, we can include it that way too. Excellent. So someone here is also wondering about who all is involved in MAiDHouse, and you mentioned the different advisory committees and your clinicians, of course. Um, Anyone else that you have there? You have you have social workers, nurses, chaplains. Anybody who else is working in this space with you?
No, we have people who bring their people with them. So we've had, some people would consider people, but we've had people's pets that do join them. Some people have come with end of life doulas. As I mentioned before, we've had some ministers who come to do blessings and things like that, but that's what people organize. We don't have anyone else. I do have the opportunity potentially to partner with someone who might be willing to provide a small choir who would sing or provide music. And I do have connections to therapy dogs, but people also just bring their own animals. So again, it's what people choose or bring with them.
Okay, excellent. Thank you. Um, So we're about at the end of our time together today, but I think to end, is there any other memorable moment that you've had that you wanted to share with everyone today, just to give an additional glimpse into what your role is like and what it's like to be involved with MAiDHouse?
Memorable moment. I think that being there on the day of profession has many memorable moments, and seeing, I think I've shared in other spaces when people walk in the space and just that relief that they feel safe and that this is a good place and matches their thoughts of what they were looking for them and their friends and their family and those they've chosen to have support them, and just seeing that profound relief is, I just watching people respond to the physicality of this space has been an experience, a new experience for me.
Thank you so much for sharing that with us today, Tekla, and for all that you do and all that MAiDHouse does in the community. And we're also grateful for the role that you play when it comes to MAID access and supporting people through those very important, very profound moments in their lives. So we are going to wrap up for the afternoon. I want to thank everyone again for joining us today, and thank you, Tekla, for being our guest speaker. Um, as we mentioned, the session has been recorded, so it will be available on our website for anyone who joined a little bit late today.
And
But
I
with that,
join in your gratitude. Thank you to Dying with Dignity Canada to showcase these different organizations as part of the series. And thank you everyone who is joining us or will watch this later in terms of engaging and exploring end of life conversations and the different things that go to support people as they are on this part of the journey.
wonderful. Thank you so much, Tekla. Thanks, everybody, and have a great afternoon. Bye-bye.